I finished the race and I literally said, I feel no pain. And that was my greatest goal. My name's Amanda Resek, and I'm 50 years old. I've evolved over time to an endurance athlete. I definitely started off as a competitive swimmer, so started swimming competitively when I was 5 years old, swam through college, and then sort of transgressed into like triathlon. I love to run, love to bike, completed half marathons, marathons. I did start training in 2019 for my first half Ironman and finished my first half Ironman in 2021. Basically, I'd gotten out of the swim, felt incredible, jumped on my bike, and it's a 56-mile bike. So at mile 1.5 exactly, I didn't see a marked pothole in the road. And so my water bottle in the front kicked off. It went underneath my tires. I was traveling at about 21, 22 miles an hour at that point, and I slid on my right side and, felt the pain, but at that point, I guess in my mind, thought I could probably still continue. I had little scrapes, but I righted my bike and I got back on. And I rode the rest of that 56 miles, got into transition, and started the run. And I do think that it was pure adrenaline that got me through probably the first 3 to 4 miles. I knew I was hurt. I knew I was in pain. At that point, I'm still thinking I can finish this race. And at mile 6, I decided I knew I couldn't. And I knew I was really hurt. And so I stopped. I was in pain. I was hobbling for several weeks. I again knew this was not something just soft tissue. And so I couldn't go upstairs. I really struggled to get in and out of the car. I struggled at work to get up and down, and definitely had pain 98% of the time. So it didn't matter if I lifted my leg, walked, tried to do a hill, tried to go upstairs, tried to roll over. It was all localized right to my hip. 100% I couldn't run. Couldn't run, I knew it. There was no way. Yeah, so got my MRI, realized it was a labral tear, knew I had a couple options, and it was either surgical or PRP. And to me, PRP seemed like a really cool approach. Certainly as a veterinarian, I understand the basis behind it, so I knew the medicine behind it. When I talked with the first orthopedist, he had recommended it. And then that led me to you. I think the blood draw to me was a non-issue. And in retrospect, with the injection, I definitely would have taken the inhaled anesthetic. There was discomfort with the procedure, so yes, in hindsight, I would have opted to have the additional anesthetic agent, but other than that, I thought it was fine. I tier pain based on childbirth, and so that is at the 10, and I would say this was probably somewhere around a 6 or 7. It started on day 1, so I did go home and rest. I did have a lot of, stiffness, which I anticipated, and pretty much was a couch potato for the first night. And then by day 2, I was up and walking with a little discomfort, still, some stiffness, which again, I expected. And then by day 3, I was back to walking in a normal fashion. So over the course of several months, I was going to the physical therapist at least once a week, sometimes twice a week. And we were working just on strengthening my hip. So it did take about 6 months of physical therapy before I was able to start running again. Around month 6, I was cleared to start to run on a track or a treadmill, a soft surface. So that recovery looked like running for 30 seconds and then walking for 2 minutes, and running for 30 seconds and walking for 2 minutes. And I really only started at about a half of a mile of running and built that to a mile, and then built that to 2 miles, and then built it to 3 miles, and kept building upon it. So swimming and cycling, I would say I was at about 100% of what I could do, other than I was a breaststroker, so I couldn't, and I didn't do the breaststroke kick just because of the motion. So I was smart about that. I knew that that had hurt prior and didn't want to re-injure. Really running without pain was goal number one, because as you and I talked, the last thing I wanted to do was re-injure myself. And to me, it's important at this age to get through life without pain. And so step one was, hey, go out there and run 3 miles and feel good at the end of the day, and not walk with pain, not wake up with pain, not struggle with pain. And so when I accomplished goal number one, which was to run 3 miles without pain, I was ecstatic. I was so happy because my body felt so good. And it continued to feel good and continued to feel good. And I just kept building on that to get to the 9 miles and the 10 miles and the 11 and 12 and 13 miles of running, and really end those runs without pain was amazing, and still is amazing. So you had told me, you're gonna do another half Ironman. And at that moment, 6 months prior, I didn't know. I was hopeful. I really didn't know. And so my initial goal was to complete a 5K with my sights in mind to complete another 70.3 Ironman this year. And so not only did I do the 5K, I did a 10K. I did the half marathon. I completed a sprint distance triathlon, which I placed first in. Olympic distance triathlon, which I placed first in, and actually achieved age group nationals again, which was one of my goals. And then the penultimate race was my 70.3. And so I completed that and felt absolutely amazing. No pain, none. My goal was really to stay healthy, to stay fit, and to continue on this journey. So I'm capable of what I was doing prior to PRP, and I've built on it, and I actually feel better than I did prior to the injury, which is even more incredible. So when I do go out and run, I feel no pain. I literally feel incredible. Oh my goodness, give it a try. Like, I'm a true testament of someone that can perform at that higher level and feel no pain. So for me, it was the perfect option, and I'm so happy, and I'm grateful to you for believing in me, but just for the whole process. There are other treatment modalities out there, and I think we have been deep-rooted in surgical correction for some of these problems when there are alternative therapies and they work. So I am that testament to that process.